everyone, and welcome to the first edition of Talking RegMed. I'm joined today by Lauren, who is the editor of NeuroCentral. This afternoon we're going to be looking deeper into using cell therapies to treat spinal cord injuries. So Lauren, could you give us just a little bit of background about the history of treating spinal cord injuries?
So this is an area that we've seen a lot of growth in recent years, especially in the last decade. We've seen a massive increase in the number of trials in this area. So at the moment, while it is rapidly evolving, we haven't yet got an approved stem cell treatment for spinal cord injury. There are a number of studies investigating the effectiveness and safety of stem cells as a treatment. This recent study that we're going to look at is one of those. They are showing promising results, but as yet we haven't reached that point. One of the things that remains most unknown in this area is what kind of stem cell is going to be the most promising. So we can be looking at mesenchymal stem cells, so these are mostly derived from bone marrow. And so these can prevent activation of inflammatory responses that lead to cell death. But so far we've had mixed functionality improvements with these experiments and studies. We've also had limited data from studies using embryonic stem cells, although we're only just starting to look at these in human clinical trials. Previously this was all animal studies. And then also limited data indicating some promise in peripheral nervous system stem cells. So these secrete nerve growth factor, which is obviously going to help stimulate that regrowth. But only one study so far has really shown most promising improvement in both sensory and motor function.
Fantastic. So obviously the study that we're going to talk about this afternoon is the recent Asterias study using the OPC1 cells. So what is the importance of this study?
So firstly, these OPC1 cells, these are oligodendrocyte progenitor cells derived from human embryonic stem cells. So the first stage of this study, which isn't the part that we're focusing on today but still relevant, investigate a single low dose of these OP1 cells in patients with thoracic spinal cord injuries. So this stage wasn't looking for any clinical benefits, it was simply looking at safety. But following that stage, we've now got this most recent data coming from the phase 1/2a study, looking at an escalating dose of these OPC1 cells, and that's specifically in patients who have a cervical spinal cord injury. So this study is the first human clinical trial with a stem cell treatment for spinal cord injury, so it really makes it a significant study. And so far we've seen some really promising results. So patients with this cervical spinal cord injury have seen partial functionality restoration in both sensory and motor areas. So this is really exciting, and we're looking forward to seeing what the next findings will be.
Wow, so it looks like we can expect lots of exciting developments over the next few years. What will be the challenges in taking this work further?
So I think when transplanting these cells, we're relying on these cells to regenerate and induce that repair in the spinal cord. But what we don't really know yet is how this treatment might vary amongst individuals. So it's really getting that data in from multiple patients with injuries and seeing, is this a reliable treatment, and where can we go from there? I think another challenge will be, this most recent trial specifically looked at patients with cervical level spinal cord injury. So how does it translate to different levels of the spinal cord? So we'd like to see, could we translate this treatment to thoracic region, other areas of the spinal cord? And finally, at the moment, the study is still looking to recruit more patients to try this treatment, but it's looking specifically to deliver the treatment within 14 to 30 days post-injury. So looking forward, could the treatment successfully be administered after this? We could be months, years after injury. Could we still get functionality back for these patients?
Great! So it looks like there's going to be lots of exciting news to come in this trial. We'll be following it on NeuroCentral and on RegMedNet, so make sure you've signed up to both those sites to catch up with the latest news in regenerative medicine and neurology and neuroscience. Join me again for the latest edition of Talking RegMed, and I'll see you again soon.